Wendy's got the good music going today. Hi, everyone. Thanks for joining me today with the Friday Ask the Expert series. For those of you who don't know me, and how dare you, I'm Maggie LaBranche Gonzalez. I'm an attorney with Litherland Kennedy and Associates, and we're an estate planning and elder care law firm located in mostly sunny Campbell, California. This year's been kind of an exception, but mostly sunny. Today I'm joined by Tami Anastasia, who is a dementia consultant, expert in all things dementia, I think related, and all around amazing human, right, Tami? I think that's just like a summary of that.
Thank you, Maggie.
Before we start the presentation today, I'm going to go over a couple of ground rules so that we don't forget for those of you watching. My recommendation is to view this in presentation mode. Tami's going to share a little slideshow for about 15-20 minutes, and then we'll open it up for your questions and answers. And speaking of questions and answers, there's a little bit of a difference between a question and an answer and a chat. So if you have a question about for Tami or for me or just in general, right, put that in the Q&A box. You'll see that kind of down below. If you have a technical issue, you can't hear us, you can't see us, Maggie's talking too fast, or she looks really great today, just a comment, great. Put that in the chat. We have our amazing marketing manager, Wendy, who's with us today, and she'll go over any technical issues that you might be having. Let's see, we're recording today's webinar. So at the end of the presentation, we will be posting it on our YouTube channel. So if you'd like to share it with other family members or friends who didn't get to participate today, you want to watch it again, right? Then we'll send out a link also in our email that'll go out later, or you can request it if you didn't get it. Okay, so enough about that. Today's topic is all about signs of dementia, right? It's more than just the, oh my gosh, I walked into this room and now I don't know why I was here. I put my keys down and now I can't find them, because I'm sure nobody here has done that, right? It's really about, I suspect it's happening. What does it look like? What's the baseline knowledge of all of that? And for those of you who know me, and I'm very vocal about this, that's how I met Tami. I've known her for at least 10 years because my grandmother had Alzheimer's. So we went through this whole process with Tami. My grandfather was in her support group for the caregiver. And I think we either really had a hard time or we were in denial about the signs of dementia, or maybe a combination of both. And so just a story about how we sort of figured it out. There were two really big things that happened. And a lot of it, I think, and as a caregiver, you tend to downplay it to your family members because you're living in it, right? And you can kind of say, well, oh, it just happened this one time, and you kind of forget. And we weren't there all the time, but I distinctly remember calling my grandparents. And you have to know that they are the sweetest people, were the sweetest people on the planet. My grandfather was a principal. My grandmother, who had Alzheimer's, was an early education teacher. So just to give you that context, because I'm calling them and they're having an argument. And you don't usually see your grandparents argue that much, number one. And number two, she just started swearing like a sailor. And I did not even know that she knew those words. I had never heard him say those words. And it really made me think, that's not really her, right? There's something else going on. So that was one thing that started to play out. But then one time she fell and she hurt her hip or back. And we ended up spending a rotation of family members with her 24/7 as caregivers. And that's when we really got to see some of these signs that I think we had been ignoring, right? And so Tami's really going to talk about today, the difference between what is just normal average aging. They walk in the room, I forgot what I was doing, and the no, they're driving around for 2 hours and they can't find their car, right? Yeah. Or can't find their way home or something like that, right? And so Tami's going to take over. She's going to share some slides, and then we'll open it up for your questions and answers. And there we go. So Tami, okay. It's all on you now.
Well, thank you for having me. And it is one of the most common questions I'm asked is, how do I know if I'm not getting Alzheimer's, or how do I know I'm not getting dementia? Everybody is really terrified of getting dementia. So hopefully today, my presentation will give people peace of mind and also be able to have better distinctions of what is normal aging versus the warning signs.
It's hard. And again, you're in denial. And a lot of times, like I was saying, I think a lot of it was hidden from us. We didn't spend a lot of time with my grandparents. in average. And then so you sort of just chalk it up to, they're just getting older.
Right. Right.
And then it was when we finally really got involved, it was probably much more advanced than we had really anticipated.
Yeah, by the time someone really does get a diagnosis, they've been showing symptoms, they've been symptomatic at least 3 to 5 years, and before I do get started, the spouse will often, the caregiver spouse or the care partner will often cover up for the other spouse. So your grandfather, knowing him as well as I got to know him,
Yes,
did a
he was
pretty good job
pretty
of
good
trying to disguise it and compensate for her,
Yeah.
so in all fairness. So
That's true.
that being said, let me go ahead and share my screen and put my PowerPoint up, and we'll get started and make sure everybody can see my PowerPoint. Yes.
I can see it.
Okay, fantastic. So thank you again, Maggie, for that nice introduction. And as Maggie mentioned, my name is Tami Anastasia. I'm a dementia consultant, educator, and also the author of Essential Strategies for the Dementia Caregiver. I have a private practice and I work with families, and I provide counseling, dementia guidance, emotional support, and care strategies. And I also offer these services to professional caregivers. I also facilitate several caregiver support groups as well. So today, the focus of my presentation is going to be on the warning signs of dementia. But first,
Tami, before you get started, I just want to point out, if you don't already have Tami's book, you should absolutely get it. It's a really great resource. I wish that you had written it when we first started this journey, because even now reading it, having read it, and I know a lot of it we learned working with you over time, but it was, man, just like having that resource to go back to, like, what do I say when? What does this happen when? So if you are dealing with this or have somebody who is dealing with this, hands down, absolutely make sure that you get Tami's book. Okay, that's all I'm going to say. Go ahead.
Thanks, Maggie. Yeah, I have to say my book does walk you step by step through this whole thing from the beginning of even early on, all the way till end of life. So thank you, Maggie, for that. So let's talk about some things that are dementia related that often people confuse dementia with Alzheimer's. So the goal is to have clarification on what dementia really is. So what is dementia? Dementia is a general term used to describe people with cognitive impairment that interferes with daily living. And that's the key, that the cognitive impairment has to interfere with daily living. So we have what is called dementia, and we have MCI, and then we have what is called dementia. And you can have MCI, which is not dementia, but once mild cognitive impairment, that's MCI, mild cognitive impairment. 50% of people with mild cognitive impairment, it can progress enough that it interferes with people's quality of life, interferes with your ability to perform daily activities. That's what makes it dementia. Now, there's over 100 different types of dementias.
Wow.
And the most popular one, the most common one, is called Alzheimer's. And Alzheimer's distinguishing characteristic is short-term memory loss. Not everybody with different dementias we're going to see short-term memory loss quickly. Short-term memory loss could be later down the road, like frontal temporal dementia, which we know Bruce Willis just got diagnosed with. The signature characteristic there is we see personality changes, we see behavioral changes, and memory loss will be farther down the road. But with Alzheimer's, we're going to see short-term memory loss pretty quick, right at the very beginning. The hippocampus part of the brain is what's getting affected, and therefore Alzheimer's happens to be the most common kind of dementia. So dementia, think of it as a category. We have cancer, and you've got lots and lots and lots of different types of cancer. Well, dementia is the category we use for cognitive impairment. So we can have, like I said, 100 different types of dementias. So think of dementia as a category, and then Alzheimer's is a type of dementia. So it just gives a little clarification on what dementia is versus what Alzheimer's is. So
what kind of things are you looking at when interfering with daily life? Is it just like I said, you put your keys down, you can't find it, or it's really non-functioning, like they're not able to drive, they're not able to,
right,
talk, they're having a hard time eating, because a lot of the physical stuff really shows up too.
right.
But is there kind of a guideline for that in
Yeah.
general?
Yeah. As a matter of fact, you'll see all of that in the warning signs. That
Okay.
will really
Okay.
clarify what you'll be looking for. And then of course, ask any questions afterwards.
Okay. Yeah.
But absolutely all of that
Okay.
will be covered
We're
because
gonna go over. You're just telling me nicely to say, calm down, Maggie. We're gonna
no worries. Not at all. All right. So we have a basic now, a better understanding what dementia is, and then we know Alzheimer's is a form of dementia, but just know there's 100 different types of dementia. Then does dementia only affect memory? So kind of going with your thing, Maggie, a lot of people think, well, my loved one doesn't have short-term memory loss, therefore they don't have dementia. Not true. Dementia affects all aspects of cognition and mobility. So it affects language, reasoning, thinking, processing information, problem solving, judgment, mobility, executive functioning. Here's one of the classic signs, like scheduling. They get their appointments mixed up. They can't remember if somebody called a few minutes ago and made an appointment. They'll call the office, want to make an appointment. They've already made an appointment. Executive functioning, we'll see, and then of course visual spatial perception. So it's super important to realize that it's not just memory loss that makes it dementia. Okay, then do people with dementia have control over the things they say and do? So many times my private clients will say to me, my loved one's just saying these things to hurt my feelings. My loved one's doing these things intentionally. And the truth of the matter is, when they get a diagnosis of dementia, who they were, how they were pre-dementia is one thing. When we get a diagnosis of dementia, or we see the cognitive impairment is severe enough that it's interfering with their ability to perform daily activities, they lose the ability to censor or filter the things they say and do. That is due to the brain damage that is occurring as a result of dementia. So once somebody gets diagnosed or again shows significant impairment, then you need to know they don't say and do these things to embarrass you, to intentionally to hurt you. They truly have no control over the things they say and do.
That's a hard lesson to learn though, because you want to take it personally.
Yeah.
We used to have these cards. Did you give them to us, Tami, about it says like this person has dementia? Yep. Yeah, yes. We used to have these cards. I saw them the other day. That's why I remember I saw them the other day in the office. So if something like that happened when we were out and about, we would just kind of nicely pass this card to them so that they knew that whatever was said or whatever was done, they didn't have any control over it, and to be nice and empathetic and understanding of the situation. So.
That's right. So they're called companion cards. And so what I do, they're wallet size, right? They can fit inside of a wallet. And you don't flash it in front of your loved one, but sometimes they'll blurt things out at the restaurant that are inappropriate. They may say things that are just incredibly embarrassing. So there are these little cards that you hold up and say, please excuse my loved one. He or she has dementia. And people are very, very empathetic. So let me tell you a funny story. It's not funny, but a true story that happened. So a client of mine, they've been traveling with his wife, and I don't know how much longer his wife has dementia. They could be traveling. So he and his wife were going on a trip, and they were at the airport, and she started to scream at the top of her lungs, "You're hurting me. You're trying to kill me. You're taking me away because you want to kill me." So the cops come, and I had just sent him my companion card the week before. He pulled it out of his pocket. And the cops totally understood now what they were dealing with. But these companion cards come in really handy. And of course, obviously they didn't go traveling, and they haven't traveled since. So, but he too had to get used to the idea that his wife doesn't have control over the things that she says and does. And this has been very helpful. Are people with dementia aware of their limitations? Here's the reality of that. 60 to 80% of people with dementia are not aware of their limitations. So many people with dementia get accused of being in denial. What you need to know is if there's damage done to the frontal part of the brain, the temporal part of the brain, which is on the side by the ears, that is where self-awareness is stored. If there's damage done in that area, the person living with dementia is not going to be aware of their limitations.
Right.
60 to 80% of people have this limitation, and it's called anosognosia. There's a medical term for it. anosognosia, anosognosia. So what a lot of people try to do is to convince their loved one living with dementia, you have dementia, you have all these problems, and they get really upset. And the reality is that's doing more harm than good, because the person living with dementia, if they don't see it, it's not because they're in denial. They don't see it because there's damage to that part of the brain. Now, that being said, I don't know about you, Maggie, but when we're aware of it, we can get a little disturbed by it. Like, oh my God, is this signs of dementia? So a lot of people who are concerned will often ask me, do I have dementia? Because they're concerned. So it's really an important distinction to keep in mind, that trying to prove a person living with dementia, all of these things, all of their limitations, is really only going to create a lot of animosity and tension between the relationship. And you really don't need to go there, or is it advisable to go there? Yeah. Just realize that there's damage, and that
and every situation is different. I've had clients come into the office completely aware of the situation. You know, they've been diagnosed, it's very early. They know they kind of understand what's coming. But then I've had clients who clearly have dementia, are in denial. Speaking of which, my own grandmother, right? Completely in denial about it. I don't have it, it's not me, They don't know, but they know, but they don't know, they don't want to talk about it. So it just, every situation is slightly different. And it depends, like you said, where you are on the scale too, how impacted everything's kind of gotten.
Right. And by the time you get a diagnosis, where are we on that path? Is it early stage, or are we farther along? And there again, I will tell you this, the minute I'm talking with, and I do a lot of counseling with people who do have dementia, because they like to talk about it early, very early on, what this means to them and how they feel about it. And the early stages, when they have that awareness, but if we don't catch them at the early stages and they're farther along, most likely they're not going to have that self-awareness, because damage has already been setting in. And so Maggie's absolutely right. And everything I share today is very individualistic, right? I'm sharing generalities. I'm saying things that are general things to keep in mind and to be aware of. But every single person is different, and dementia affects every single person differently. So this was just some basic information I wanted to clarify, since there's so much confusion, and I just kind of wanted to sort out some general information. So next, let's talk about what are signs of normal aging. Hopefully I'll bring a lot of peace of mind to a lot of people. First of all, entering a room, forgetting why, and remembering later.
There's my example. It's the first thing everyone says. Oh, no, I've completely done that.
Totally normal. We all do it. Now, what we have in our favor is we're aware we entered a room and thought, what did I come in here for? Most likely we forgot because we got distracted. We got a phone call, but we're thinking about 5 things at once. But then you remember later. Okay, so you have an awareness going in, you have an awareness that I forgot, and you have an awareness, oh yeah, now I remember, right? So that's key. Missing a monthly payment and realizing it. So I'll use myself as an example. I am still old-fashioned. I love getting bills in the mail. I don't love bills, but I like to get my bills in the mail. And now a lot of things are online. I'm not used to that. So I'm thinking, oh my gosh, I think I missed a payment. And sure enough, I had, because my system now isn't working the same way. And so I realized I missed a monthly payment. I have to come up with another system, and know now I have to go online, as well as write down what things are online and then what things I still receive in the mail. So missing it and realizing it. So every once in a while, we might miss a payment, but we realize we missed it. Saying the wrong day and correcting yourself. Well, a lot of us went through this during COVID. Those days blended for a while, right?
Yes.
So we do say the wrong day, but oh yeah, or weekends, or what about a 3-day weekend, right? We've got Memorial Day coming. Now Monday's going to feel like a Sunday, or Sunday's going to feel like a Saturday. This is common, okay? Not being able to think of the correct word, but it comes to you later. That happens to me a lot.
Happens to me all the time.
Yeah. And then it comes to you, right? And then I always tell people, I'll call you at 3 a.m. when I remember what the word is. But the thing is you realize it. It's not coming to you and you're like, oh, what is that word? And then, oh yeah, that's right. Normal aging. Being absent-minded, distracted, and preoccupied. You know, a lot of people will tell me it seems like we get busier as we get older. We get more distracted. We get more preoccupied. And absent-minded is absent-minded. We do get absent-minded now at times, right? Now, if you're caring for a loved one living with dementia, these are going to be classic. You're so overwhelmed. You are so distracted. You are so preoccupied. And a lot of my private caregivers, family caregivers will say to me, Tami, I think the dementia is rubbing off on me. Number one, it doesn't rub off. And number two,
not contagious.
And number two, truly, they're so overwhelmed. That's a red flag for me to say, okay, we've got to figure out a way of you getting more respite and having more time to yourself. So then it does take longer for us to complete tasks. You know, it does, as we get older, it just takes us a little longer to complete tasks. That is normal aging. Here's also what's normal aging is you're able to retrace your steps. You're able to go back into the room, remember what it is I wanted to get, and I can find it. I can go and get it. You're able to retrace your steps. It's super important. And you're able to recall and retrieve information. Normal aging, and you still recognize familiar people, places, and things. Okay, so these are all signs of normal aging, and hopefully a lot of you just took a deep breath and said, whew, hallelujah, I'm still in the normal aging.
I was going to say, you pretty much described everything that I do on a daily basis.
Okay.
Like, I'm overwhelmed, so I'm all of these things, you know?
Yeah. And you'd be amazed being overwhelmed, how distracted, how that interferes with our thinking, right? But that's normal aging. Now, let's talk about what are signs of dementia. Experiencing memory loss and increased confusion. This is more than thinking today is Saturday. Oh no, it's still Friday. When we talk about increased confusion and memory loss, we are talking about not remembering things that are super familiar. I had a client the other day. He and his wife went to the grocery store. And the wife said to him, oh, wow, I like this store. Have we been here before? And it's a grocery store they've gone to for many years. Okay. Increased confusion. They'll get the past confused with the present. They'll think that something's going on that happened 20, 30 years ago. And they're thinking, oh my God, they're having to deal with it today. Okay. So when we say experiencing memory loss and increased confusion, it's severe. It's not what we just talked about, going into the other room and thinking, oh, what did I want to get? Or forgetting that word. And then it comes to us. Okay. Then we have getting lost going to or from a familiar place. This is a classic warning sign.
I've lived this. My grandmother went to Westgate, went shopping, couldn't find her parking spot, and spent 2 hours with a security guard driving around trying to look for her car. You know, that sort of a thing.
This is a classic. And sometimes, you know, a lot of people will say, well, when should my loved one stop driving? And we look for dents in the car. We look for different dents in the car. Sometimes people will see them going over a huge, you know, those parking cement stubs. They go over it like nothing. But getting lost going to or from a familiar place. I have a friend who's a brilliant surgeon. And she called me and said, Tami, I'm lost and I don't know where I am coming home from the hospital. And I said, you know what? You got to go get evaluated for dementia. Sure enough, she's got a diagnosis of dementia and is no longer practicing. Increased clutter such as unopened bills, delinquent notices, and magazines. Now, I know we all have different levels of cleanliness, but this is severe, meaning, especially if we take someone who's always been pretty well organized, you're going to see increased clutter. You're going to see unopened bills. You're going to see delinquent notices. And by the way, if you do see a lot of that, then we were probably having some problems managing our finances. That's usually a red flag for us to say, uh-oh, somebody's going to need to step in.
Come and see Maggie, because we need to figure out what's going on. Yeah, exactly.
Come and see Maggie, absolutely, and figure that out, how we can protect that person from financially getting scammed or taken advantage of, right? Yeah.
Absolutely. Start taking credit cards away. That's all I can say.
Yeah, yeah. Okay, then they'll repeat the same questions over and over. Classic. That's a classic sign. They'll repeat themselves over and over, and it's the same question. And people get incredibly frustrated by that. And the reason for that is two things. One, they have short-term memory loss, so they don't remember. And number two, they don't remember the answer. So short-term memory loss is what contributes to that a lot. And there's some value in understanding that. When I work with clients privately, I use that actually a lot to help figure out what is on a person's living with dementia's mind and sorting out the things that are important to them. So even though it's a warning flag here, it is super valuable and beneficial when I'm working with private clients. Also, having difficulty scheduling and keeping track of appointments. That's the executive functioning, right? Financial planners, attorneys like Maggie, medical doctors, they will call me and say, oh my God, this person, financial planners especially, this person, Tami, I think I have a client who's exhibiting signs of dementia. They can't keep track of their appointments for the life of them. And of course, what you want to keep in mind with these warning signs is it's way out of character also for the person you know. These warning signs, and they're going to have more than one warning sign. I hate to say it. It's not just going to be, oh, they just repeat themselves over and over. You're going to probably see there's a few of these warning signs playing out. Unexplained weight loss, empty refrigerator, or one full of expired food. So a lot of times when I'm called out to do an assessment, one of the first things I'll want to do is go to the refrigerator if they live alone and see if it's full of expired food or it's completely empty. That's a red flag for us. Now, unexplained weight loss is something that's super important to take into consideration regardless if it's dementia or not dementia, and I'll tell you why. There are other medical conditions that can mimic signs of dementia. And if somebody has unexplained weight loss, I would certainly advise you to go to the medical doctor, let them know that you've noticed, weight loss, and I would do a workup. I would do a medical workup. Make sure something else isn't going on medically. You want to rule that out anyway. Also, being unable to follow directions such as a familiar recipe. So I have a daughter who called me and said, I think my mom has warning signs of dementia. So I just had her describe to me, and what makes you think so? Mom is an avid cook, loves to cook, and cannot follow a very familiar recipe she's been cooking for years and years and years. That's a red flag.
That happened with my grandma. I just think now that you mention it, we were on vacation and she made like cookies or brownies or some sort of like baking treat that easily can follow a recipe.
Yep.
And cooked it, so proud of herself. And everyone kind of took a bite and was like,
what is this?
Yeah, I think we used a cup of salt instead of a cup of sugar, something like that. It was like, oh, okay.
Yeah. Where's like the butter?
Like, she's not hosting Thanksgiving anymore, that sort of a thing. Yeah.
Right. And somebody's a real handyman. So I had a wife who called me and said, I'm worried about my husband. And oh man, what a handyman. He can't put something together. He can't follow the instructions. Another classic sign, right? Personal hygiene, we will see a change in their personal hygiene. And someone who's always been so clean, so prim and proper, all of a sudden is wearing clothes that are dirty. They looked a little unkept. They're not showering. There's body odor. Those are another classic red flag. And then we have having problems with words, language, reading, writing, and or speaking. Now, that goes back to, this isn't about forgetting what word, this is about using words out of context making sentences that don't make sense, having fragmented thoughts, like you're putting two fragmented thoughts together in one sentence. So this is what we're talking about when we're talking about having problems with words, language.
Or what about just not being able to speak at all? Have you seen that? Or right, like they've just forgotten or can't physically make
Yep.
the connection.
Yeah. So what happens is that I call it brain interruption, that, the messaging center is our brain and the cells are our communication hub. And so the cells are not firing properly. And so you get stuck and you can't remember your train of thought at all. Now we all have moments of that, right? But this is abrupt. This is so obvious that I can't even get back to even what I was thinking. And that again, Maggie, is where we'll see them going off in a different tangent, right? They'll have three different thoughts that make no sense and they go veer off in all these different directions, or absolutely they'll get stuck and they can't complete what it is they want to complete, nor does their brain have that recollection of what it is I want to complete. So excellent example. Then we have demonstrating impaired judgment or difficulty completing daily tasks. Okay. Now we all make bad decisions now and then, and I'm guilty of it, but impaired judgment. So my father at the time was very sick. And before he passed away, my father was one of the smartest people. He could read people very, very well. And he started making these decisions and the family's like, wow, that is so out of characteristic for dad. My dad did not have dementia, but he had diabetes and he had heart issues. And I think there was a lack of blood flow getting to the brain when we look back now, but his judgment was way off compared to how we knew it. Incorrectly taking medication or forgetting to take their medication. Classic red flag. Medication management becomes an issue. And they may get paranoid. They don't know why they have to take it. They may think you're trying to poison them, and that often comes down the line of progression. But early on, we'll see medication management become an issue, a warning flag. And then misplacing items and accusing you of hiding or stealing them. I would say repeating the same questions over and over and misplacing items and that accusations drive caregivers to drink. I mean, it is
my mom dealt with that with my grandmother, and I think she had the hardest time not taking it personally. She was the bad guy.
Yeah.
She stole all her jewelry,
Yep.
hid everything from her, took all her money.
Yeah.
If she was in the other room, she'd come in and be like, I know you're talking about me. What are you talking about me about? And
yeah.
And being the brunt of that day
Brutal.
after day after day, it's really hard on a caregiver. You need a Tami in your corner to remind you that it's not you, it's not them, it's this disease.
Yep. Yeah.
That's a big one, I think.
Yeah. Those two are the ones that I experience a lot. I spend a lot of time with clients dealing on how to deal with that, because it's painful and it is so hard. And you just feel beat up. You get blamed all the time. But let me give you an example of what happens to the brain and why that happens, right? So think about it. I'm going to use myself again as an example. When I was a kid, I played a lot of sports. My mom always said, if you want to go back out and play, bring in your dirty clothes, put them on the bed. When you're done, after you're done, come back home and I want you to put your dirty clothes into the washing machine. So sometimes I would throw my dirty clothes on the bed, but I'd come back and they weren't there. And I'd go and say, Mom, I can't find my dirty clothes. Oh, well, I put them in the wash because I was starting a wash. Well, I have the mental functioning that realizes I was the last one and I knew where I left them. But if I have short-term memory loss and I don't think I touched the item, I don't think I moved the item, I have no recall that I had the item, the brain's default is, well, somebody else must have taken it, right? So when you look at it that way, you see there's brain damage. Well, it makes sense that the brain's default is somebody else must have taken it because I didn't, because I have short-term memory loss. So I don't have any recollection of having it. And then a lot of caregivers will spend a lot of time trying to prove to their loved one no, you don't want to go there either, right?
It's the default, and when you say it like that, it makes perfect sense. But when when you're in the moment and you're dealing with it and
Oh,
you're so mad and so angry,
yep,
the default is to kind of prove your innocence. Like, I never touched it. I
that's
didn't
right.
even, you sold that 20 years ago, or you gave it away. Don't you remember? That sort of thing. You just
Yep,
want to defend yourself
yep.
without realizing that it's not going to make a difference, because next tomorrow you'll be doing the same thing all over again.
Exactly. So I just coach clients on how to do that, how to deal with those responses, anticipate them, and then we prepare you in advance to how to respond. So these are all really good warning signs that I think will help clarify. Again, you see the difference between normal aging and now the warning signs of dementia. There is a pretty good distinction, right? So now, what are the hallmarks of dementia? Again, their symptoms will gradually get worse over time. That's what you need to know. This isn't going to be a one and done. This isn't going to be a fluke. Oh, that just happened. It's going to start increasing. And we're going to start seeing probably more than one warning sign. We're going to start seeing two, and it's increasing even more, right? So what you need to know about dementia, unfortunately, there's no cure. It only gets worse. Now, how the rate of progression varies from person to person, but this is not going to get better, and it's not going to go away. However, if we do have that unexplained weight loss and we go and we check out and there's something medically going on and the symptom goes away, we've taken care of the problem. With dementia, it does not go away. They may have personality changes, and they will certainly have behavioral changes, right? You'll see slight changes in the personality. Some will just say, oh, I don't see the changes so much in personality, but you will always see changes in behavior. Always. You'll see that things are just changing. And then the familiar is no longer familiar. They don't know what items are for or how to use them. So Maggie, that goes back to what you had asked me on that first slide. Familiar is no longer familiar. My keys, I don't know what my keys are for. So let me give you an example. I have a husband and he's taking care of his wife, and she's out digging, thinking she's using a shovel, and what she's using is a spatula.
Well,
So,
it gets the job done, I mean,
right,
honestly,
exactly.
but it
They
doesn't
don't
make
know
any
what,
sense.
right, exactly. In cooking, we'll see a lot of times they don't know how to use the utensils as dementia progresses. Now, early on, something was just going to seem off. And that's the other thing I want to say. Trust your gut. If something seems off, most likely something's off. What is off is what we want to go and explore. But I always tell people, trust your gut. Something is telling you something, and now we just want to explore what might it be. Could it be a medical non-dementia related issue, or could it be signs of dementia? Super important to pursue that. And then I call it, they can't do the 4 R's. They cannot retrieve information. They cannot retrace their steps. They do not remember and cannot recognize familiar places and items and people. That is a super easy way to remember the hallmarks of dementia, is they can't do those 4 R's. And then their cognitive changes have to interfere with daily activities. And daily activities could be, we have what is called IADLs, instrumental activities of daily living. That's your managing your finances, that's scheduling appointments, that's going to and from a familiar place. And then the ADLs are more like dressing, toileting. We see progression in that as that becomes much more difficult as dementia progresses. But earlier on, we're going to see what we call interference in the IADLs, the instrumental activities of daily living. So you suspect that your loved one has signs of dementia. What do you do? So first thing is you want to start documenting your observations, and I'll tell you why. Because we start playing mind games, right? So, and we play mind games throughout the whole journey. Caregivers will say to me, maybe my loved one's not as bad as they are, because in the split second, all of a sudden their loved one living with dementia is clear, has some lucidity, and they think, oh, it's not as bad. If you document your observations, it's going to provide clarity for you. And then if you're dealing with other family members who say, oh, I talked to mom, or I talked to dad, or I talked to, our sister, they sound great. You want to have this documentation because it's going to add clarity to how often, how frequent, what are the behaviors that you're observing. And physicians love data. Here's the date, here's the time, here's a log, and it summarizes all the things that you are witnessing that are going on. Then primary doctors can refer you to a geriatrician, a neurologist, or what we call a neuropsychologist. Usually it's going to require one of these 3 types of doctors to do the assessment and to do the testing. Then you want to provide a very detailed family history and arrange for a battery of tests. You're going to want to get blood tests done, cognitive and neurological testing to assess their thinking and their physical functioning. All right. And then we do the brain imaging, an MRI, a CT, or a PET scan. A lot of times what happens is they will only get one test. They'll do one cognitive test. There's usually 2 popular ones. There's either the mini mental status exam or the MOCA, they call it. And MOCA is the Montreal Cognitive Assessment. And all of a sudden now we base everything on that one. Well, if the scores are low enough, great. But if the scores are borderline, you want to get a battery of tests so we can have a thorough evaluation done. I always get a little concerned when it's just based on a test, because I think we need more than one test, especially if they're on that real kind of borderline a little bit. Let's get some other tests to confirm and get a more definitive diagnosis. And then we want to rule out other medical conditions that contribute to personality and behavioral changes. For example, side effects of medication, huge. That can have a tremendous effect on a person. We want to rule out dehydration.
Dehydration, yep.
Dehydration with older people, brutal. Then we want to rule out a urinary tract infection. We want to rule out a B12 vitamin deficiency, right? We want to rule out thyroid deficiency. So it's always good to get a really thorough evaluation, and blood tests tell us a lot as well. So these are some things to do if you are concerned that your loved one has dementia. So I think what I'd like to do now, Maggie, is I'm just going to close with a quote. And the quote goes as follows. One person caring about another represents life's most significant value. If any of you are on this call today and are taking care of a loved one living with dementia, I would like to thank you for the love, the support, and the care that you provide day in and day out for your loved one. So I am happy to go ahead and stop share, and we'll take some questions. Okay, Maggie?
You're going to make me cry, Tami.
Yeah.
I'm telling you, Tammy's the best. So if you're having questions about it, start with Tami and she'll be a good resource or just helpful.
Yeah.
We do have one question and I have other questions for you.
Great.
Do all types of dementia show up on a CT scan or some of the other brain scans that you were talking about?
Yeah, that's an excellent question. You might see different things going on in the brain, right? When a person has a stroke, they can tell what part of the brain has been affected. So what a CT or an MRI does do, at least it shows you what is happening in the brain, how much white matter they call it. I believe in, I'm not a medical person, but I think a brain imaging is always very good. Can they tell? So that I honestly don't know from a medical standpoint. What I can tell you is they'll have brain imaging and you'll be describing the behaviors, right? You'll be describing what you're noticing. So it's kind of like we need that whole big picture of what it looks like. Lewy body dementia plays out a little differently than Alzheimer's or frontal temporal lobe or vascular dementia, right? Vascular dementia has to do with blood flow, right? Lewy body has to do with these Lewy body proteins in the brain. So the brain imaging will it will tell us something in addition to what are the behaviors you're observing as well. That's a great question.
Yeah. And if you guys have questions, now's the time to ask because we have Tami at our disposal. So I have a couple of questions. And I remember when we were going through this, one of the things that we didn't really realize as we were going through this is kind kind of the stress that we put on our loved ones when we're trying to maintain our normalcy, right?
Yeah.
We think that, and I know my grandpa was for sure guilty of this, was
Yeah.
just like, it'll just kind of get better, or she'll remember it more if we just keep the same routine going. If we take her out to lunch with her friends, right? And just kind of keep this sort of normal going. And I think what we learned through Tami and everything else is it's actually much more stressful on them because they have to remember and recall things more frequently that they can't, right? They physically, mentally, and anything like that. So I was wondering if you wanted to talk a little bit about that.
I do actually. Actually, a consistent routine is actually really, really, really good for the person living with dementia, but the consistent routine has to be modified to at their level, right?
Mm-hmm.
And then we want to provide that cognitive stimulation. We want to have people come and take them out. We usually put up a whiteboard, or we'll put up Post-it notes and create this structure. So structure is really, really very important, but we have to modify it so it's at a level that they can maintain and be able to do it. That being said, then we have this fine line between overstimulating them and them being understimulated, right? So a bored brain, BORED, is has consequences as much as an overstimulated brain. So it's that fine line of figuring out what's stimulating. But yes, we do want to have a consistent routine. Morning, we have breakfast. The activity, like 1 to 2, let's say, is an activity. That's when we do some type of activity. Is it going out in the garden? Is it going for a walk? The activity itself can change, but we have consistency in the routine that, from 9 to 10, it's breakfast. Then from 10 to 11, it's a puzzle. Then 11 to 12, it's lunch. And again, it's that we have a sequence of events is done in a certain order every day. They do quite well when we provide that consistency.
Okay, we have another question. Susan said that the CT scan was negative. The MoCA was borderline. So Kaiser did not actually diagnose dementia, but she's seeing some of these other warning signs, right? Can't find her way home. There's other warning signs. So now, should they redo the testing? Maybe something else is going to show up now. It's further along. When do we keep kind of going back now that we're sort of seeing other things and say, hey, Kaiser, it's time, like do it again? Yeah.
So here's the nice thing about an image. If they don't show anything early on, we have a baseline, we call it, right? Then a year from now, 2 years from now, 3 years from now, if at some point it's going to be very clear this person has dementia, right? We don't like to put them through a ton of brain imaging either, right? We might wait a year, but I would encourage that we get a little more testing and assessments done for sure. I would request another blood test. And again, I don't know what the time frame is. If it's been at least a year since that first brain scan, I think it would be okay to ask for another one. But also have all these observations and have more data to support why you think something is going on. And I would pursue these other things. Sure, absolutely, because they're increasing, right? They're not going away. And I'll give you a very good example. So I have a family I'm working with. It's his mother, and it is the son and the daughter-in-law. Perfect example. Clearly has signs of dementia. Has dents in the car. She's living alone. They went to go see the primary doctor the other day, and he said, my mother has dementia. And he says, I don't see it. She's fine in my office for 10 minutes. What happens 4 hours later? Mom thinks that somebody's stealing out of the bank her money, goes down to the bank, calls 911. The police come down to the bank, and they had just had an appointment 3-4 hours before. Wow. And the doctor says, I don't think your mother has dementia. I said, we're done. We're getting a new doctor. We need to go to a neurologist. So there you go. Pursue it, because in that 10-15 minutes, believe it or not, they can step up to the plate. Social graces is one of the last things to go. They can step up to the plate. So I say pursue it. You're seeing symptoms, pursue it.
You're your own best advocate or the advocate for someone else. Like
Absolutely.
I
Absolutely. Yep.
completely
And we
agree.
switch doctors till we find the right doctor who's going to hear what we have to say, that's going to listen to the data. So I say absolutely pursue it. She's showing more signs. We want to go ahead and pursue that.
And just to piggyback off this is a great time to review your estate planning documents, because if you don't have the ability to go with your loved one and they're having a good day, they're going to say, or they're not having a good day, they're going to say, I don't want them in the room with me. I'm fine.
Right.
And if the doctor doesn't have permission to talk to you, they don't have a release, there isn't a diagnosis of dementia, they could say, no, I'm not talking to you. I'm talking to my patient.
Exactly. And if you are the family member and you do want to communicate to the doctor, give all that data and do not do it in front of your loved one living with dementia, because then they'll blame you for every problem from here to Tokyo. And we do this behind the scenes, because they can get very upset and very frustrated. And how many of them will say, I don't want to go to the doctor? No, they don't want to go to the doctor. So we have to strategize on how we make that happen as well.
We're not going to the doctor, right?
Yeah. Yep. And it's true. I have to be honest. I'm going to piggyback off of what Maggie said. Get those, if you can, get that financial, get the legal stuff in place now, because it is brutal as this progresses and you have to deal with it. So I'll encourage everybody to follow up and make an appointment with Maggie. Even myself, I'm doing.
See what we did that? See what we did there? I don't see another question, but I have another question for you.
Yeah.
The loss of autonomy is a huge part of dementia, right? It's the not driving anymore.
Yeah.
It's taking away the financial independence, the credit cards, the spending. It's a two-way street, right? Because at the one hand, you want them to be safe, and the other hand, you don't want to deal with the whole, I don't want to drive, or I don't want to take their credit cards. I want them to be able to do what they want to do. So when you start seeing signs of dementia or unsafe driving, right, you've seen the dents or everything, do you think you could give some helpful advice for encouragement for people to feel okay and safe about removing their credit cards, lowering the limits, taking the keys away, or something like that?
Yeah. So what Maggie just mentioned are things that I deal with a ton in my private practice, right? These are issues that come up. When you start speculating or start thinking that your loved one with driving, we don't want the caregiver to be the bad guy. We could have the physician be the one to report it to the DMV. You could report it anonymously to the DMV. But you trying to prove to your loved one that they should not be driving is going to create so much stress and tension, and they will accuse you of taking their independence away. You're trying to control them. They're going to go there anyway, but we don't want you to be the bad guy. We want someone else to be the bad guy. So if it gets to that point, when it comes to managing finances, we take the backdoor end of that as well, because we try to control it from behind the scenes so that they don't feel you're trying to, quote unquote, take everything away from them. So if you're POA, you see Maggie, if you're POA for finances, we're good. If you're not, we do things behind the scenes. And there's a lot. Actually, I just did a seminar yesterday on financial safety and dementia and all the different steps you could take that doesn't involve your loved one. But the ideal is to be the POA of their finances, power of attorney of finances. But what we do is whatever we can do behind the scenes is what we try to do. We put a credit freeze if we can. We contact some of these do not stop the junk mail. There's things we could do. Maybe we could get on a signature card at the bank. It's got to be a we and an us thing. If you say anything that points out that they're the problem, it's going to make them super defensive. So one tip I'm going to give you today that you want to take away is going forward, anything you want to do or say to your loved one, it's no longer you've got to do this, you've got to do that. It's time for you to take your medication. It's a we and us. We and an us is going to diffuse that defensiveness. It's a we and us. So for example, I've got to go make some changes to my bank account because somebody, there's this scam going on. And I was thinking, hey, mom, you know what, this would be something nice for both of us to do together. I've got to protect myself. We want to protect you. Would you be willing to go and do it with me? Because I really don't want to do it by myself, right? There's strategies to how we encourage and foster that cooperation. And is it going to work 100%? Nothing's 100%. But I'm so determined to try to figure it out, to try to help these families, that I'll try to think of any strategy I can think of. But you do not want to be the bad guy. You're in a tough enough position that we have to do things behind the scenes, and or we get a third party, an authority figure, right? Maybe a CPA, an attorney, a medical person be the third party to advise doing this. But we want to minimize what the caregiver goes through. Yeah,
absolutely.
great question.
And from a legal perspective, for everyone sitting out there saying there's no way I could remove their autonomy and driving and all of that stuff, from a legal perspective, if you've seen the warning signs and you know that they're having a problem and they get into a car accident and something happens, then that's where the trouble is really going to come, because you've had the ability, you know, right? You can't say you don't know. And so like Tami said, you can have someone else be the bad guy. You can have the doctor, you can have the attorney, you can write an anonymous letter and let DMV do the bad
Exactly.
stuff, right? Let DMV be the one. Let them be the one. How dare DMV say that I can't drive? I mean, what are they going to do? Go argue with DMV? Great. Okay.
Then as the caregiver, you're supporting that they're so upset and they're angry, but they're not, you're not the person who, quote unquote, who made this happen, right?
Right.
Exactly. Because I will tell you this, when that happens, you've taken their independence away. I would say finances and driving are the two most difficult, upsetting for the person living with dementia. And then the third one is when it's time to move them into a care community, right?
Yeah.
So, but these two are, they are so elevated emotionally. They're very, very, very difficult.
And it weighs on the caregiver too. I think
it really does
for both of you, for both of them.
Yeah. As a caregiver, the caregiver wants this acceptance, this approval. So we try to approach them logically. We try to use reason, and it doesn't work. It backfires. And then we go over explaining, it backfires. And, you know, my rule of thumb with people living with dementia, the less you say, the better. And we find other ways to get what needs to be done without trying to make you the bad guy. And we want to still respect the person living with dementia, right?
Absolutely.
We want to be very, very compassionate towards them as well.
One last question. We have one last question. Okay. I know that progression is different. Everyone is different, but in terms of a general, are we talking about years? Or are we talking about decades? Is it months? Like what are we going to be looking for in terms of the warning sign progression?
Yeah, you know, I know people never like my answer because I got to answer it truthfully. It varies from person to person. Let me tell you why. Number one, how old were they when they got diagnosed? What I can tell you is if they have what we call early onset before the age of 65, it tends to progress quicker.
Wow.
You know, are they diagnosed in their 70s, their 80s, their 90s? What is their health condition when they get diagnosed? And it just varies. And then all bets are off if they break a hip. I mean, there's so many, or they get pneumonia, or, you know, anything can happen medically. And it really varies. So I cannot give a definitive timeline. It can be years. I don't want to freak anybody out, but my grandmother back early in the 70s, they thought it was senility at the time. My grandmother, now that I'm a dementia expert, she had classic symptoms of Alzheimer's. We had no idea what it was then. Again, this was, 30 years ago, 40 years ago. She lived for 22 years.
Wow.
Now, she got diagnosed at 75 and died like at 101, 102. So that's my grandmother. But then again,
so on the other side of that, my grandmother was much younger.
Yeah.
And we, like I said, stepped into it much later than we had anticipated. I think it was kind of shocking how far progressed she was. But then, once you see it, you're like, oh, this makes perfect sense.
Yeah.
And then the dips that Tami was talking about, she had hurt herself, right? we saw a dip in the cognitive decline. We moved her into a facility that because we couldn't care for her, and my grandpa couldn't obviously care for her, we saw another dip.
Yep.
And so she ended up progressing. And so from when she was diagnosed until when she passed away it was, you know, maybe 5 years at the most.
Yeah. See, it just totally varies, again, based on the age, based on the medical history, based on you know, how healthy they are, you know, do we have underlying health issues? Is there, again, any medical things that, you know, somebody who gets a lot of UTIs that can expedite surgeries, anesthesia affects the brain. Do you know what I'm saying? So very, very difficult to answer. I will tell you this though, you could go, in my book, I have 4 stages. There's also 3 stages, there's 7 stages. What I would do is get acquainted with the content at the stages. So it kind of gives you a heads up as to how this is going to progress and what behaviors and what changes to look for will be super helpful. But timeline specific, we can't give that.
Everyone's different.
Yeah.
All right. Well, Tami, I want to be respectful of your time and everyone else's time. So
Yep.
Thank you, Tami, for joining me.
Thank
I
you,
hope
Maggie, for having
everyone
me.
really understands now that maybe you're just a regular getting old person, or maybe now you need to go talk to your doctor. I mean, who knows?
Yeah.
A couple of things that I want to announcements before we leave. If you found our office helpful, the Ask the Experts helpful, I really ask if you guys will do a review for us on social media. So whether it's a Yelp or Google or something like that, we'll send out a link. That would be really great. If you are clients and you're thinking it's time for you to review some of your documents, we have a client review webinar next week, and also to sign up for the Ice Cream Social. So if you're not a client and you want to know what the Ice Cream Social is, I mean, doesn't that sound great? So we'll send out links for that. At a minimum, I would recommend everyone sign up for the newsletter because it keeps you up to date with any of our upcoming events. And again, we are recording today's webinar, so it will be posted on YouTube. So if you want to watch it again, you want to send it out to friends and family, it'll be available. And have a great Friday, everyone. And thanks again, Tami.
Thank you, Maggie. And thank you, everybody, for attending. Take care, everybody.